what do you say to people who claim the US gave kids 72 jabs compared to Denmark, which only gives 11?
Yeah, so this claim comes from another graphic that's been shared by people like President Trump. It's similar to the one that I talked about that was used in the last ACIP meeting that claimed that babies are given so many vaccines before the age of 1.
Ow!
But it's about the number of vaccines being given by age 18 in the US before RFK Jr. changed the vaccine schedule compared to after. And it uses some creative math. Basically, to get to 72 jabs, which is the term that people in the UK have always used for vaccines, but I guess people in America thought it sounded more severe and adopted it when talking about anti-vaccine policies, you would have to count every annual flu shot, but you would also have to count multi-disease vaccines as individual doses. So, for example, instead of 2 doses of the MMR vaccine being 2 jabs, you would have to count them as 6 jabs because they contain antigens for 3 different diseases. But obviously, that doesn't mean that they are 6 injections. That's kind of the whole point of putting diseases for multiple antigens into one vaccine. You reduce the number of injections overall. The same is true for things like Tdap. Instead of 1 injection, it's counted as 3, and so on. Now, the funny thing is, for the comparison of now kids only get 11, they count the vaccines as they are supposed to, meaning that they count the MMR vaccine as 1 vaccine instead of 3. So that claim is based on really picking and choosing when to be honest based on when it suits you. People like to make this claim because it sounds really overwhelming. So you should also remember that while we are vaccinating against more diseases, we use fewer antigens. So the amount of antigens that kids are exposed to protect against 16 or so diseases is actually lower than the amount of antigens that were used to protect against the 8 diseases we vaccinated for in the 80s. So it's not at all overwhelming the immune system. If anything, it's less than what we did before. For more on this and other stories making sense of public health, download Health Wanted where you get your podcasts or stream on YouTube at WABE ATL.